I saw that CCMI has and that's complete concussion management, has a 10-day return to learn /work/play protocol. Right now, we use a 5-day return to sport protocol only for our athletes. Do you feel like a 5-day protocol is adequate for our situation, considering we cannot make educational accommodations for patients? I'm not quite sure what the educational accommodation for patients part means, but we have a 10-day protocol, not even a 10-day protocol, we have a 10-step protocol. And I think that's a huge distinction to make. We're not concerned with the number of days necessarily in your protocol. We're concerned with the number of steps. So let's change 5 days to 5 steps. Is that adequate? According to the International Consensus Statement, the return to play process is a 6-step return to play. If you look at the return to learn process, it's a 4-step return to learn. And if also when you're dealing with adolescents, the recommendation from Davis in 2017, which was a systematic review that kind of informed the Berlin Consensus document, they said that return to learn should be completed before return to play is initiated. So what you end up with is a 4-step return to learn and a 6-step return to play, and what you get is a 10-step protocol. And so that's all we've done in our protocol is put the return to learn in front of the return to play, just to put more steps into the process. And the reason that we've done that, and the reason that other people are calling for that, is that just relying on symptoms for an individual is actually inadequate. The brain takes longer to recover from a metabolic or functional standpoint than it does for the symptoms to go away. So just because the symptoms have gone away and you've passed a 5-step protocol, which you could theoretically get done in 5 days, that is definitely inadequate, because the research on this has shown that the human brain takes between 3 to 6 weeks to recover appropriately. So when you're just relying on getting through your 5-day step, yes, that is definitely inadequate. You should be adding more steps into the process, and you should also be trying to add some objectivity to it, such as physical exertion testing, baseline pre and post-injury testing, in order to try and truly understand when somebody's metabolic recovery time has elapsed.